Good afternoon. Welcome everybody back to Facebook Live here on the Oneida Nation Reservation. Today is Monday, June 1st. I'm Bobby Webster. I'm the Public Relations Director for the Oneida Nation. Today there's just Debbie and I. Debbie's going to do the update, our medical update on the COVID situation. And unfortunately, due to some scheduling problems, we weren't able to get the COVID team here today. They're wrapped up in a conference call that's taking a lot more time than we had anticipated. So we will reschedule with the COVID team. It's been 130 days since the business committee started tracking this COVID issue, what it was doing to our community, and March 12th they declared the public state of emergency on the reservation. So we've been living this for quite a while. And things have changed on the reservation. We've become very astute to what's going around us in terms of people with masks or without masks, sanitizing ourselves, making sure that when you go into a public place that business is taking care and caution to wipe down their surfaces, especially shopping carts. You rarely see children in the stores with adults anymore. I know we still keep all our grandchildren home, not taking them into the stores. We do see some people taking their children into the stores, but that it's not over yet. We're not that safe. We encourage you to be safer at home, especially the children. So right now I want Debbie to give us our health update, and after that I've got some information, some messages we want to share with you. Debbie?
Thank you, Bobby. Well, good afternoon, everyone. I just want to start out with providing the numbers first. Globally, we're at 6,193,548, and that's as of this morning. Deaths globally are at 372,479. Within the United States, we're at 1,790,191, and deaths for the United States are at 104,383. Within the Indian Health Service, now the Indian Health Service is a little bit lag behind in terms of the updates for the numbers, but as of May 30th, within Indian Health Service, we have 10,900 positive cases. The Albuquerque area is at 725 positive cases. The Bemidji area, which is where we are within Minnesota, Wisconsin, and Michigan, we are up to 236 cases. In the Navajo area, we're at 6,085 positive cases. Phoenix is at 1,715 cases. For the state of Wisconsin, we're at 18,403 positive cases with 592 deaths. For Brown County, we're at 2,319 positive cases and 37 deaths. And for Outagamie County, we're at 227 positive cases and 8 deaths. For Oneida Reservation, we are at a total number of 46 cases. Brown County is 19 cases within the Oneida Reservation and 0 deaths. For the Oneida Nation, for Outagamie County, we're at 27 cases, and sadly we have 2 deaths. I do want to mention the fact that we have been monitoring the numbers, not only just within the health center, but also locally as well, and we have seen an increase in the numbers since the Supreme Court overturned the Safer at Home order. We have started to see increases in our numbers, and that was what was anticipated. But because of that, we really cannot stress enough to the community that it's extremely important that everyone continue to practice safety precautions, such as social distancing, wearing your masks, or some type of facial cloth covering now more than ever before. With the nicer weather, people want to get out. We understand that. People want to enjoy the sun, want to enjoy the nice weather. But I've seen personally people not wearing facial coverings, people gathering in larger groups without that protection. making sure that, you know, they are continuing to practice those safe measures is something that we can't stress enough. Because the weather's nice doesn't mean the virus is less prevalent, and it doesn't mean that it's less dangerous. Unfortunately, people are assuming that because that safer at home order ended, it's good, everything's fine, and we can go back to normal. But unfortunately, we need to stress people need to continue to wear their masks, especially if they're going out grocery shopping, going out to the public, making sure that you're practicing safe distancing between each other. On another note, I just want to talk a little bit. Last week there was some mention in terms of the concern about the pharmacy and why we went to 30-day refills. So I just wanted to mention first that we did have some issues with our pharmacy because of the Memorial Day weekend and the increase in prescriptions. One of our robots was down, resulting in an increased waiting times and increased times to pick up prescriptions and delays in the prescriptions not being ready. So I just wanted to express that we certainly apologize for that inconvenience. However, we are making efforts to try and address what those issues are. I know that last week several people had to wait in line. Some had to be asked to wait outside last week because of the numbers of people that were picking up prescriptions. And again, I wanted to stress the fact that we are continuing to monitor safe distancing and making sure that people are wearing masks. But we just want to ask for your patience as we try to get caught up with those prescriptions. Last week we were about 500 to 600 prescriptions behind due to the mechanical issues with the robot in the pharmacy. And now we were able to get that repaired as of late Friday, and we are getting caught back up on the prescription. So hopefully we won't have issues this week of long waiting lines or waiting outside. So again, we apologize for those delays. Last week there was a question that came up on Facebook Live about the reason for the 30-day refills. And we did post the response, but we just wanted to reiterate that the reason for the 30-day supplies of medications was for two reasons. Basically, there were certain medications that we had sporadic shortages of nationwide. So we were only giving 30-day supplies for those particular prescriptions. We didn't run out of the key prescriptions such as the insulins or the inhalers, but there were random shortages that occurred with specific medications. To minimize the loss of revenue due to the loss of insurance by many patients, we requested that we dispense a 30-day supply of the medications as a cost-saving measure. And pharmacy was able to serve every patient with the needed medication as promptly as possible. So I'm happy to announce that as of today, normal dispensing will resume as in the past. So if your prescription was written for 90 days, your prescription will be filled for 90 days as of today. So thank you, Bobby.
All right, thanks, Deb. We do have a shorter program today, as I mentioned, but we did get a question on whether or not the tribe is considering extending the safer at home order. And right now, everything's on the table. We're still watching the statistics and examining all the metrics that surround us in terms of that COVID pandemic, the testing that's going on. As Debbie said, since that election, we have seen an increase. So we can't say that, you know, we can guarantee when the safer at home will end. But even when it does end, as we've said in the past, common sense tells you, if you don't feel safe out there, don't go. Wear your mask, you know, continue to sanitize. This is going to be the new normal that we have to invoke in the community. We know that our message is getting through to people. I just wanted to let you know that our segments get over 3,000 views every week on every Facebook Live. So our people are listening, they're paying attention, they're being educated, they're getting informed. We want to thank you all for continuing to watch and continuing to support our efforts to reach out to the community. We also want to extend our heartfelt condolences again to our families in the community who are in mourning right now. In the past 10 days, we've lost about 6 of our Oneida members, our citizens, that have walked on to the spirit world. So we say prayers for those families. We extend our sympathy and our condolences. 2 of those individuals passed away due to the COVID. Others had other problems that contributed to their death. But we certainly reach out to you all, and we know it's hard not to embrace one another, not to touch one another, not to shake hands. And we have a new normal. We've experienced funeral processions in which you're able to drive by and extend your sympathy and your condolences to the family. We just hope the weather continues to hold out for us. It's been very difficult for these families not to feel that love, so continue your prayers. Tomorrow is June 2nd, and the Oneida Green Bay 4 Paths One Stop will be opening late. They won't be opening till 10 a.m. tomorrow. That's the one on the corner of West Mason and Packerland, due to finalizing some of their systems upgrades. So plan accordingly. That will be opening late tomorrow. We also want to advise everybody to mark your calendars for June 11th. Although that's the day the safer at home order may end or may not, we do want to invite everybody to a tobacco burning. We have been asked by people in the community to do something to bring our minds, bring our hearts together, and to feed our fire that's within us by praying for our community, helping us through recovery, and bringing people back into the community with a more spiritual sense. So on June 11th, we'll be holding a socially distanced, safe with your masks event on the powwow grounds, weather permitting. We are going to get more details out to you, but I just wanted to let you know that we want everybody to come together. It doesn't matter if you're Longhouse, if you're Methodist, if you're Catholic, if you're Chickasaw, Choctaw, Cherokee, Oneida, whatever. We just want our community to come together, and we find the prayers are healthy for us. They've been helpful, and we want everybody to join together in that effort. June 11th, and as I said, we'll be getting more information out. Another initiative, it's called Feeding America. It will begin Friday at 10 a.m. We are going to invite people to come to the food distribution on Water Circle Place from 10 a.m. till noon. And there's going to be grocery boxes that will be distributed. There's no paperwork, there's no red tape, there's no bureaucracy. You drive up, you stay in your vehicles, follow the directions. There'll be signs posted, limited quantities, first come, first serve. So that's going to start at 10 a.m. this Friday, June 5th. Other days for pickups will be June 12th and June 19th. So remember that. It's going to be at the food distribution by the big water tower off of 54 in Oneida on Water Circle Place. Also, we know it's going to be very hot this week. We expect to hit 90 and 80 degree temperatures. However, unfortunately, Oneida Lake remains closed due to some of the construction that needed to be done and was called to a halt. We are not able to open the lake this summer at all. Our parks in our community are also still closed as of today yet. So we hope that things let up somewhat in the community so we can open up some of our parks. Our trails and a lot of our other outdoor venues are open. But at this time, parks and the lake are closed. I also want to remind people of the graduation parade for our Oneida Nation High School seniors. That's going to start at 6:45, staging at the Oneida Nation Turtle School, and they will be driving over to Norbert Hill Center at 7 o'clock to have a procession, a parade, a graduation, a celebration for our 2020 senior class. And that's all we have for today. Sorry this is such a short session, but Friday we'll be back, and we've invited Chairman DeHassy Hill and Vice Chairman Brandon Stevens to talk about the federal as well as the state initiatives that are affecting us on the COVID, talking about some of the stimulus dollars that are coming through, some of the contacts that we have in Washington and in the state, some of the issues that are impacting us, where we're at, and working with the other tribes, as well as hopefully some information about all the tribes in Wisconsin, their gaming, how it's going, some of their statistics, and we hope that they're moving into recovery in a good way as well. So I want to thank you. As always, say your prayers and stay healthy and be well. Skana.